This video is about obsessive-compulsive disorder. Although obsessive-compulsive disorder was previously thought to be relatively rare in the general population, recent studies have estimated prevalence of 2.5% to 5%. That is 1 every 20 persons around you will have OCD. The essential features of obsessive-compulsive disorder are recurrent obsessions or compulsions that cause distress or significant impairment, and the person recognizes that the obsessions or compulsions are excessive or unreasonable. Obsessions are persistent ideas, thoughts, impulses, or images that are experienced as intrusive and inappropriate and that cause marked anxiety or distress. The individual feels that the content of the obsession are not within his or her own control. The most common obsessions are repeated thoughts about contamination, for example, becoming contaminated by shaking hands. Repeated doubts, for example, wondering whether one has performed some act such as having hurt someone in a traffic accident or having left a door unlocked. A need to have things in a particular order, for example, intense distress when objects are disordered or asymmetrical. Aggressive or horrific impulses, for example, to hurt one's child or to shout an obscenity in church, and sexual imagery, for example, a recurrent pornographic image. Thoughts about God and religious ideas. The individual with obsessions usually attempts to ignore or suppress such thoughts or impulses or to neutralize them with some other thought or action, I mean a compulsion. For example, an individual plagued by doubts about having turned off the stove attempts to neutralize them by repeatedly checking to ensure that it is off. Compulsions are repetitive behaviors, for example, hand washing, ordering, checking, or mental acts, for example, praying, counting, repeating words silently, the goal of which is to prevent or reduce anxiety or distress. In most cases, the person feels driven to perform the compulsion to reduce the distress that accompanies an obsession or to prevent some dreaded event or situation. For example, individuals with obsessions about being contaminated may reduce their mental distress by washing their hands until their skin is raw. Individuals distressed by obsessions about having left a door unlocked may be driven to check the lock every few minutes. Individuals distressed by unwanted blasphemous thoughts may find relief in counting to 10 backward and forward 100 times for each thought. The most common compulsions involve washing and cleaning, counting, checking, requesting or demanding assurances, repeating actions, and ordering. By definition, adults with obsessive-compulsive disorder have at some point recognized that the obsessions or compulsions are excessive or unreasonable. This requirement does not apply to children because they may lack sufficient cognitive awareness to make this judgment. Obsessions or compulsions can displace useful and satisfying behavior and can be highly disruptive to overall functioning. Because obsessive intrusions can be distracting, they frequently result in inefficient performance of cognitive tasks that require concentration.